So from Monday, some lockdown restrictions will be easing in England. We just heard about some of the measures that will change in Scotland. Do you think it's too soon to be easing the lockdown?
Well, there's an awful lot of people, Sophie, who are absolutely desperate to get back to work. There are children who need to go back to school, and Labour supports the lockdown easing, but it's critically important that as that happens, it's done in the safest way that it possibly can be. And I think that's where, over the weekend, we've seen some scientists in particular raising concerns about whether the way the government is going about this is safe or not. And we need to make sure maximum safety is always applied so that the public can be reassured that what they're being asked to do is safe for them and their loved ones.
I want to just try and pin you down on some of the specifics, because of course everyone wants to make sure that things are as safe as possible. I don't think anyone would disagree with that. Schools are right at the top of the agenda at the minute, with more primary schools in England opening to more pupils from tomorrow. Now, on last week's programme, Sir Michael Wilshaw, the former head of Ofsted, said that keeping kids away from school risks a lost generation and undoing some of that progress that's been made for disadvantaged children in recent years. So does Labour support more primary schools going back from Monday or not?
Labour supports a gradual reopening of the schools in a way that is safe for children, for teachers, for everyone else that works in the schools. And it's critical before parents are not going to send their kids back to school if they don't think it's absolutely safe to do so. So there's an issue here about reassurance and providing parents with that information. But where it's possible to open schools, then absolutely we want to see schools open. I'm aware that in some communities up to a third of children are not getting any education at all because they don't have the technology at home that allows them to have lessons. Now, 2 months, 3 months, 4 months, potentially for a child to be out of school is an incredibly big gap in their education. So all of us want to see schools open, but it has to be done in a gradual way that maintains parents' confidence that it's safe for their child to go back.
You're the Shadow Community Secretary, so you're responsible for local government. I mean, is it acceptable that there's a bit of a piecemeal approach here, with some local authorities recommending that schools open, some not? We're effectively living in a postcode lottery when it comes to our children's education.
Actually, local authorities will take decisions that are appropriate for their areas based on the science and the data as it applies to their locality. We don't have a single rate of infection of this disease across the whole country. It's much higher in some areas than it is in other areas. So the way to deal with that is to set clear national standards that everybody can understand, but allow for flexibility in how those are applied in particular localities.
OK, so just to be clear, what are those clear national standards then? Because I think it's important to be specific. Are you saying that if infections are above a certain area in one local government area, then it's acceptable for schools to open? What are those national standards?
Where the rate of infection is higher, as it is in some areas in the northwest, for instance, we've seen some councils, I think, in the northwest, both Labour and Conservative, talking about not wanting schools to reopen quite as quickly because the rate of infection is higher. Now, the national standards say it should only be done in a way that is safe to limit the spread of infection. Now, I think it's quite right to have a set of national standards like that, but local application based on the different circumstances in each locality.
So what should the cut-off be then?
If you try to apply one size fits all to this, when the circumstances are so very different in different parts of the country, you'll put children and their families at risk, and nobody wants to see that. The schools need to open as fast as possible, but it has to be done in a way that's safe.
So what should the cut-off be then for an acceptable level of infection for schools to reopen?
Well, that's going to be a decision that will be taken locally. It's not going to be dictated by me.
Well, schools are opening from tomorrow. It's the kind of thing you should have worked out by now, isn't it?
Well, it's the kind of thing that local authority leaders have already been working out by talking to teaching unions, head teachers and parents region by region. The way they've done this in Wales is worth looking at, because the Welsh Labour government brought together the education unions, parents groups, health experts, and they built a consensus around that. Now, I'd like to see that happening in England. Unfortunately, so far, the government hasn't chosen to go down that route. But I think the key to reassurance of getting this right is to build consensus as much as possible.
So if you're saying that what's happening in Wales is the right thing to do, where they're not reopening schools, are you saying that schools shouldn't be reopening from tomorrow?
No, I'm saying the decisions need to be taken based on the circumstances in different areas. We want schools to open as soon as possible because that's the best thing for children. But we don't want schools to open in areas where it isn't safe. I have all that information sitting here in London. Those are decisions that need to be taken locally based on local circumstances, and I believe that's the right thing to do.
OK, now a big part of the government's route out of lockdown is the test and trace system. It's only just started. There has been concern from some union leaders, some teaching union leaders, that schools shouldn't be reopening until that's had time to really bed in. What do you want to see?
Well, with contact tracing, I mean, it's critical if we're going to safely ease the lockdown. The test, trace, and isolate program works very effectively and efficiently. People can't start going back out into the world if they're not certain that people who get infected can be identified and asked to lock down. Now, the government has, in my opinion, wasted time on getting this program right. Just it was Friday last week, so with 4 working days to go until Boris Johnson's deadline for having what he called a world-beating contact tracing system up and running by tomorrow, when local authority leaders were told they were going to have to take a lead in this. The government had 2 months before that when they could have been talking to local authority leaders, and council leaders were telling them 2 months ago that they wanted to be in. The government was too slow in involving them. Nevertheless, local authority leaders, and that's where the contact tracing expertise is based, have stepped up. They've been working with government and putting together a program. Where we saw over this weekend some scientists raising concerns, just like local authority leaders have done, that everything is not yet in place for that system to be absolutely robust. So we are calling on the government at pace to fix some of the remaining problems. We believe they can do this quickly. We need to see better data sharing so that local authorities know exactly who needs to be contacted and asked to isolate. Local authorities are saying they need more powers to enforce local lockdowns if there's an outbreak, for instance, in an office block or a particular street. And where there are people who, for reasons of their own personal income, are less likely to self-isolate if they're asked to, because they're self-employed or they're on very low rates of statutory sick pay, there needs to be financial support to help them to self-isolate. These are all things the government can fix very, very quickly if they choose to, and it's essential that is done if we're going to have public confidence and an effective and robust contact tracing system.